Are you looking to fine-tune? Whether for your business, your job, your team, or yourself. In each episode, we will be discussing different ideas and opinions using real-world examples to help you see opportunities, innovate, and succeed. Hi, it's Corby Fine, and welcome to Fine Tune. So I've always had this fantasy that I can get access to really good quality medical care when and where I need it. I don't want to wait. I hate lines. I'm that guy who, I see a line, I walk by. Not for me. Queues are not for me. Waiting rooms, scheduling appointments far in advance. I actually have had an ENT appointment scheduled for 3 months, and they've already changed it twice because of things out of my control. Just not the way that I want to be treated when I think about my health. And I'm sure most of you are in the same boat. I want to know now. I want answers now, or at least as close to now as possible. I think the Canadian medical system is actually good. I've had injuries in Europe. I've seen doctors who don't speak English. I've been treated with archaic creams that I couldn't even understand what they were. We're good here, but I think it can get better. And I think what we really want is to know that we can get access when and where we really need it. With me today to talk about this is Dr. Brett Belchetz, who's actually trying to tackle this exact issue. He is the CEO and co-founder of Maple, which is getmaple.ca, Canada's leading virtual care provider. And really they're there, in my words, and we'll ask him, to connect patients and healthcare providers like doctors and therapists, etc., for online medical visits in minutes, not 3 months with changes the way I'm waiting for my ENT appointment. He's also a practicing physician, so he knows a thing or two about a thing or two in this space. And a senior fellow at the Fraser Institute. He's been on TV. He's interviewed on CTV, Global News. I've seen him on TV, a contributor to all kinds of different media outlets, newspapers, et cetera, et cetera. And he's a pretty smart guy because he also worked at McKinsey. And we all know about the McKinsey consulting background. So, Brett, welcome to the podcast today.
Good morning, and thank you so much for having me. That's quite the billing to live up to.
Well, when you go through someone's background and you realize you've accomplished quite a bit, so congratulations to you on that. Not an easy path, I assume.
Well, thank you very much. And I would say when you look at a career, sometimes in hindsight, it looks like you've done a lot of things and you had this tremendous plan, but when you were actually going through the process, you sometimes feel like you're on a random journey and that every step was never even previously thought about or planned. So it's funny how things that when I was going through them seemed like maybe I was making the most colossal mistake of my life repeatedly over and over again, leaving healthcare to go to McKinsey, leaving McKinsey to come back to healthcare, leaving practicing to start a company. All these things seemed like, well, I really just don't know what I'm doing. So it's funny in retrospect, all this, have it look to others as if there was this incredible grand plan and that it all comes together so nicely. So kind of nice to hear at this sort of later mid stage in my life.
Well, you're talking to a guy who sold Viagra and ran a digital bank with 2 million customers. So I get the whole notion of you are a unique segment of one. And I think that's a beautiful thing for all of us. So again, congratulations. I gave a one-line synopsis. I don't think I did it justice. What is Maple? Who are the customers? Who are you targeting? And why should they consider Maple as a platform?
So first of all, I actually think you did do it great justice. Your description of the problem that we set out to solve is exactly right. So if you look at Canada's healthcare system, you're right. We do have a very good universal healthcare system where nobody gets left behind. The quality of the medical care is quite good. You generally trust that when you go into a clinic or a hospital here in this country, the physicians that you are getting are well educated, well trained. You will get top rate, well proven, well scientifically validated care. You're going to get generally the best of the procedures that are out there around the world to be had. That being said, when we compare our healthcare system to other developed world nations, something that is unfortunately the reality is that our healthcare system is typically ranked amongst the developed world nations, not all of the world, but amongst developed world nations, as either the lowest ranked or second lowest ranked performing healthcare system of all developed world nations repeatedly year in and year out. And if you want to read more in detail, there's a study that's released every 2 to 3 years by an organization called the Commonwealth Fund. They're a nonprofit that's based out of the United States. And they look at the relative performances of healthcare systems around the world. And they're the ones that are coming out with these rankings. And it's quite exhaustive the way that they analyze these healthcare systems. The main area in which Canada falls behind repeatedly, the reason why we are so far behind in the rankings is access. We have a terrible problem with access to care in our country. So despite the fact that our care is relatively fair, it's very hard to get. So we have the longest wait times for pretty much all forms of care, the longest wait times for primary care appointments, the longest wait times for specialty care, the longest average wait times in the emergency room. And this is a problem that I was living and breathing in the emergency room, working on the front lines of our healthcare system day in and day out for many, many years. So I was working in the ER for about 11 years before we started Maple. And we really tried to solve this problem because on the other side of the equation, when we saw all these people waiting 8 hours to see me in the emergency room for very generally minor needs, things that really didn't need me to touch them or do a procedure, it just needed a discussion and some observation and some treatment prescribed. On the other side of the equation, what was really interesting is when you look at the stats of physician capacity in Canada, only about half of Canadian doctors are actually working full time. So there is this incorrect assumption that a lot of people make in our country that the reason why we wait so long for care is because we don't have enough doctors. And in fact, it's because we're not using our doctors properly. So what Maple is Maple is an application, in short, to do exactly what you described, which is to tap into all of that available capacity amongst physicians, other kinds of healthcare providers, and to make that capacity instantly or almost instantly available to you in your home, at your cottage, on holiday, wherever you may be, so that you don't have to wait hours or weeks for care. You can get care in minutes, so that you don't have to travel across town for care, so that you don't have to sit in a waiting room next to somebody who has the flu or potentially even COVID when you just want to get a renewal for your prescription for high blood pressure medication. So Maple is an app that works very similarly to Uber, that you can use it from anywhere, get access to a service in minutes. The difference is that rather than getting access to a ride across town, you're getting access to a network of thousands of healthcare providers from across the country in minutes by means such as secure messaging, two-way video, two-way audio, and it encompasses all of the things that you would have in a physical doctor's visit, such as digital prescriptions, the ability to generate laboratory requisitions, diagnostic imaging requisitions, specialist referrals, etc. It's got everything you would have in a physical doctor's visit minus the physical touch.
So what's really interesting in that is I heard you talk about capacity management, but you're actually tackling that from both sides of the equation because for the patient or the consumer in this perspective, it's about my time. It's about me not having to get in my car to go do something. It's about really making my life easier. But at the same time, if half the doctors in Canada aren't working to their full capacity, you're actually helping the efficiency on the office productivity, which I guess makes them happier too and potentially makes them more money in terms of fully utilizing their time. They're not waiting around. They don't have rooms full of people. They're not making people upset. I see an NPS improvement here too. So was that by design, the tackling the efficiency of both sides of the equation?
100%. So when you think about when we started the application and started the company, I was working full time and I had this frustration when I would go to work. I had this frustration seeing those patients waiting so many hours to see me. But at the same time, I had this immense frustration as a healthcare provider. So I was working on the front lines, and as an emergency room doctor, what is considered a full-time shed of shifts is usually about 15 to 16 shifts a month. So I was doing my 15 or 16 emergency room shifts every month, and they're typically about 7 hours long, and they're grueling shifts. It's not 7 hours where you can take a coffee break or go for lunch or chat with people. It is 7 hours where you just go nonstop, 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 and the ultimate outcome from that is that at the end of your 15 or 16 shifts as an emergency room doctor, you are just fully burned out from the emergency room. So I had a lot of free time. I had about 15 days off every single month, which sounds great. And it was really good. There were a lot of times I could meet friends for lunch. There were a lot of times I could go to the gym. I could sleep in, a lot of great things. But eventually you get bored because most of your friends aren't off Monday to Friday. There aren't that many people to hang out with. And eventually you've read most books that you want to read through, etc. So what ends up happening is you get to a place where you think, I'd like to see a few more patients. But the way the healthcare system was set up, the only way that I could see any more patients was to actually pick up a whole extra emergency room shift. There was no way in that system for me to flexibly give a few more hours. And being so burned out from the emergency room, my answer always was heck no. There is absolutely no way I will do another emergency room shift. And most of my colleagues were the same. If you asked them to do more shifts, they would say no. But at the same time, most of us always thought, wouldn't it be amazing if on that Tuesday afternoon where all of our friends are working, we've got nothing to do, we've already worked out 5 times that week, we've already done all the sort of fun things you can do. Wouldn't it be awesome if on the couple hours that you're sitting in your home and bored, you could actually start seeing just a few patients and turn it off the minute you got frustrated? So a lot of the motivation behind starting this app was very selfish on my part, to be honest, as a clinician, thinking, wouldn't it be awesome if I could do this? Wouldn't it be awesome if I had this availability between my shifts to just go and see a few patients whenever I wanted? So we very much were setting out not only to solve the patient side of the equation, but we were very much setting out to actually solve this big problem that existed for healthcare providers.
Yeah, very smart. That's where the McKinsey logic must have come in. Um, so a lot of the services you talked about, the types of things that the platform and the business can enable, they feel digital to some degree. So I'd love to get your take. Do you see more of the medical system en masse, the way in which we deliver healthcare moving to this digital platform? Or, are there certain things that are just not translatable? Obviously, having to have something invasive, an angiogram, surgery. But in terms of diagnostics and some of those, lower touch things, are there any areas that you kind of say, wow, that's never going to digitize? Or are we just at the early stages of the transformation of how healthcare is delivered in Canada and around the world?
There are some things that are for sure never going to digitize. You've got a broken bone that needs to be reset and casted. I'm not going to be able to fix that through an app. You're having a heart attack. The treatment for that is going to be an angioplasty again, not through an app. That being said, there is an enormous amount of the healthcare system that should and could be digitized quite easily that goes around even those most acute episodes in the healthcare system. So leading up to me arriving at the emergency room with my broken bone, I should be able to check in and I should be able to tell my story and get a visual assessment with a clinician digitally. Once I'm there, I shouldn't have to tell anybody anything. There should be an automated system where I'm immediately seeing the doctor because all of that intake was done already. All of that triaging was done. The doctors know my story. My record is set up, and I'm only asked to come in when it's my turn. So I don't have to sit for 4 hours in a waiting room because just like many other advanced systems, they're ready for me. They tell me when they know that it's my time and they have capacity. I go in, I get casted, and I get X-rayed. Um, all of the aftercare doesn't really require a lot of in-person care either. A lot of the aftercare during the convalescence period from a heart attack, during the convalescence period, even from a broken bone or a surgery, a lot of that is just visits where the clinician is asking questions. They might be taking vitals. They're observing, looking at the wound, or they're looking at how your cast is doing. Most of that doesn't require you to go in person. But unfortunately, when we look at the way our healthcare system works right now, what we've said is we're going to take a physical first approach. And here and there, the easy things to digitize, we're going to digitize, but we're not going to even consider an omni-channel experience to healthcare like what I've described. So I think when we really extrapolate forward where the healthcare system can go and where it should go, most of it can be digital. I would estimate that about 70% of the visits that people are making to clinics, to hospitals, to their family doctors, those can be digitized. And the only things that we should be doing are showing up right when the doctor is available and ready for us, getting our physical exam and any procedure done. And then afterwards, any aftercare should also be digital unless it requires some further procedures to be done. There are some places in the world where we're much closer to that. So if you look at Kaiser Permanente, which is one of the largest hospital systems in the United States, one of the largest hospital systems in the world, they have about 10 million patients. They were pushing virtual care in an omni-channel manner long before the pandemic hit and virtual care became fashionable. And they were very, very successful at it. So their running rate of the number of visits that they do virtually versus in person is just over 50%. So just over half of their visits are done virtually. And they operate something somewhat similar to what I've described, where on any given interaction with their healthcare system, you have the option to either have that visit digitally, if possible, or in person. And people en masse are choosing digital wherever it's possible because it's so much more convenient. So when I think about where the healthcare system should go, it should go to much closer to what a Kaiser Permanente model is versus what we have flirted with so far here. And I think we've done a great job digitizing a lot of the easy to digitize things as part of the pandemic by necessity, because we had to shut down huge parts of our healthcare system. But as we exit the pandemic, I think it's imperative that we move towards that omni-channel experience. The other thing I would also say is that there are a number of people that have argued that as the pandemic fades, we will see an undigitizing of healthcare, that people will want to go back to the in-person visits. And my answer to that is there is no example in all of society of any industry that is digitized and gone back. I have never seen anybody after experiencing digitally booking their travel say, I would rather go back to the in-person travel agent. I've never seen anybody who, once they discovered online banking to pay their bills, all of a sudden says, no, I'd rather pay it with the teller in the bank. Typically, once an industry digitizes and people understand that it is effective to do these things online and the unbelievable convenience of doing these things online, nobody ever looks back. And I think healthcare is going to be the same thing.
Though I did go to a restaurant last night for the first time and it was pretty good. I will give it that, but it's not going to prevent me from still using Uber Eats. So fair point. And on that story, my son actually broke his shoulder earlier in the spring. And what was amazing was I think they tried to make it more virtual, but without the technology and platforms, upon going for a follow-up x-ray and getting told by the doctor that I would only be called or get results and then only have to come back in, I should say, if there were any issues. Not only did I not have to go back in, but I didn't even know the results. They never called. And I put a phone call into the nurse's station in the radiology department, and I still never got a call back. So I now sit around making an assumption that my son's shoulder healed all right, but I have no verification. And so I think about a digital platform that could essentially allow a physician or some sort of healthcare professional to click a button and just say like good to go and just send me a notification saying good to go. So when you talk about your platform, and now maybe let's shift into the business model a little bit, I assume that's the kind of capability at the most rudimentary basis. So on that note, who is your customer? Like, who are you targeting? Is this just healthcare professional to consumer, which is a whole layer of, government intervention? Is this private? Like what's the business model and who are you targeting as customers?
So I'll address your example quickly first before I get into who the customers are. That is exactly how our platform is designed. So if you get a lab test ordered on Maple, you have complete visibility into your lab test and you have automated notifications when your results are in. And that automated notification lets you know you're good to go, everything's normal, or there's an abnormality and you need to be seen by another clinician, and click here to see another clinician. So we are firm believers that people own their healthcare records and they should have full view into their records, full view into their results. It should never be a mystery to a patient what their results are and what the next steps are. So absolutely agree with what you're saying there. In terms of who our customers are, we started the business back in 2015, and we had a view that our customers were individual patients and individual clinicians across the country. And we really saw ourselves initially as this two-sided network, very similar to Uber, that we were going to provide services to healthcare providers so that they could provide care online. And we were going to match them with individual consumers who would then purchase those healthcare services. And in those days, it was all private because no provincial governments funded virtual care. That has changed a little bit over the years. Now, what happened over time was we realized that we had really missed a huge part of the opportunity in terms of who our customer base could be. And so that was first noticed when we started to have corporations, so employers reaching out to us. And we were started to hear these messages from employers saying, I actually just tried your service. It was amazing. I saved myself half of a day off of work. I didn't have to sit in the emergency room. I'd like to buy this for our team. What are your corporate plans like? And we had no corporate plans. We hadn't even thought of a corporate plan. We'd never even considered that use case. So after the second or third company reached out to say, what are your corporate plans? We realized, wait a second, there is actually a big opportunity in the B2B space. We can offer our service as an HR benefit to employers and to insurers and benefit providers. Let's get going on that. So we built up a whole other side of our business, which is the employer insurer side of the business, where we sell the service very similar to the way other healthcare benefits are sold to employers, but on a capitated basis. So typically an employer will pay a very small fee per employee per month for those employees to have unlimited access to the service. The benefit to the employer is that they have healthier employees, happier employees. But those employees, when they need to have routine medical care, are not waiting hours. They're not taking half of a day or a full day off of work. Their productivity isn't lost. When those employees, their kid is sick when they wake up in the morning, they're not checking out of work because they can do a visit in 3 minutes on the platform. Our average wait time is typically under about 3 minutes. So it is saving an immense amount of productivity. And the ROI calculation for employers is very straightforward. If you look at the average rate of productivity for a Canadian worker, it's about $60 on average across all types of employment. The average time in a waiting room for any type of medical visit in Canada is about 4 hours. So every single time one of their employees uses us, that's $240 in saved productivity. Doesn't take a lot of employee usages for this service to pay itself back very, very quickly for employers. And we've had great utilization, incredible satisfaction rating from employees and from employers. So that's the second part of customer. The other opportunity, which has emerged more strongly in recent years, is we've had a fair number of public sector buyers approach us. And so these are provincial governments, hospitals, healthcare systems, where they have all of a sudden realized, largely as a result of the pandemic, that virtual care works and they need to be providing virtual care. And when I hear your story actually really helps me to understand why they're coming to us, because they have tried virtual care with a half-baked solution. So either through telephone or some video conferencing system, and it's not working. It doesn't have half the things that you need, things like prescription functionality, lab result viewing functionality, and a whole bunch of other things that we've thought about quite carefully in Maple. And so we will have these hospitals and governments reach out to us to say, we want to have a virtual care program, and we'd like to consider licensing your platform for our clinicians to use to treat our patients. So over the last couple of years, we've actually had quite a bit of growth in what we call platform as a service. So platform as a service is us licensing out our technology to those kinds of buyers for them to run their own programs. And that's a really exciting dimension for us. And one of the things about that quite excites me is the fact that that is a much more scalable service than us providing our own services, especially when we think about things like international expansion. So if we were to, for instance, think about taking Maple into another country, it's very difficult for us to grow a whole new doctor network in another country, to learn all the rules of healthcare in another country, and how do we pay physicians, and how do we recruit physicians, and et cetera, et cetera, et cetera. Versus if all we're doing is selling software, that's much easier for us to go to a hospital system in the Middle East or a hospital system in the United States and say, here's our platform. You guys are in charge of the recruiting. You guys are in charge of how you manage the healthcare being provided. We'll just give you the software to do so. Much easier for us to scale that globally than the fully baked service.
Yeah, like I say often, many organizations shouldn't get into the plumbing of the technology and the platforms. And so I see what you're talking about is almost building the plumbing of the healthcare ecosystem, where governments, hospitals, clinicians, patients just have to plug in and not worry about becoming software developers in and of themselves to enable those. And I will say, from personal experience, I have a fairly progressive family physician who is trying, but even, she's limited to the capabilities of secure email and still having to take and translate what I wrote, put it into another system, send it to a pharmacy who then calls me. So I've had a lot of things done personally without actually having to physically get up and go to the physician, but it's disparate. There's no real good customer experience. And maybe that's my last question on the business. How do you measure that notion of, is this working beyond the metrics? So I get you're selling, the revenues there, you've got utilization. Are people happy? Are you measuring some sort of an NPS or satisfaction? And what does that curve look like? And how does that inform how you adapt the platform going forward?
Great question. We absolutely are measuring satisfaction, and we measure satisfaction amongst all of our customer groups. So we're measuring satisfaction amongst our individual patients. So after every single visit, the exact way that when you use Uber or Airbnb, you give a star rating to the experience after that experience. We ask our patients to rate us after every experience. So if we look at all of the ratings we've had on the platform from patients over hundreds and hundreds of thousands of visits, the average rating across those visits is 4.9 out of 5. So our patients are really, really happy. And that's not a small accomplishment in healthcare. When I look at our customer satisfaction ratings in the emergency room, we're really lucky when on average we break 3 out of 5. So we're doing quite well. The NPS, which we do track, sits at about plus 82. So if you look across all businesses on NPS scales, that's
That's
pretty
high.
good. Yeah, that's very high. We have a ton of customers that are promoters that are recommending this platform onward. When we look at the other populations amongst clinicians, they love the platform. One of the number one metrics we look at beyond their satisfaction ratings, which are very good, is are the clinicians recommending the service onto other clinicians? Because one of the ways that a platform like ours dies is you're growing one side of the network, but not the other. And so if we keep growing patient numbers, but we can't attract clinicians, that becomes a very difficult proposition over time. So we've actually been able to grow our clinician network without almost any proactive recruiting on our part over the last 5 years. So almost all of our growth is due to recommendations from our existing provider network to their peers. And the providers love working on the platform. And so that has been really nice. We've grown from tiny group of 4 providers when we started to over 1,500 healthcare providers across the country now. And that's been, again, with almost no money spent on recruiting and no proactive efforts. It's all inbound communications from providers who are referred to us. So that's been excellent. And then, of course, we track satisfaction ratings from our employer customers. We look at their retention rates. We look at their NPS rates, and those are all quite high as well. So for us, we know we're doing a good job when all of those indicators, so the direct to consumer patient ratings are high, the clinicians are still coming in droves, the employer customers are staying with us and recommending us to other employers, and they are giving us high NPS ratings as well. All of those say that we're doing all the right things.
So amazing success so far. What's next? Where do you take the platform? How does it evolve? Where are you going with this?
So when we look at the services that we have so far we've had a service that very much emulates the existing healthcare system. So I'm sick. I realize I've got symptoms. I'm going to actually request a visit with a healthcare provider. I have my visit with the healthcare provider. We provide some good follow-up services and communications, but you're kind of on your own till the next time you decide that you want to see a healthcare provider. And we've got dozens of specialties now on the platform. So it's not just general practice. It's things like psychiatry, psychotherapy, dermatology, endocrinology, you name it, it's on the platform. So it really is almost like a multidisciplinary clinic in the cloud, but it's very much like that existing healthcare system that's guided by you and your proactivity. That's not a great model because there's lots of disease conditions where people don't know when they need to get help. They don't know when their next visit should be. They don't know what the next intervention should be. They don't know when their next screening test should be, et cetera. So what we're starting to realize is that we need to actually flip the model a little bit to something that doesn't exist, which is more of a proactive model on our part, not on the patient's part. So we're starting to move towards programs of care for things like mental health and eventually for other conditions like diabetes, for smoking cessation, addiction, et cetera, where the idea would be that you're going to enter into a program of care. And rather than us waiting for you to request a visit, we're actually going to say for people with this condition, here's the thing that we're going to do. We're going to regularly check on you. We're going to see how you're doing. We're going to do the right things to check on your status for your condition. We're going to let you know the frequency of visits that you need to have. We're going to tip you off when you need a screening test done or an intervention done. We're going to have resources available to you between those healthcare visits. So it's not just see a healthcare provider and you're kind of on your own till the next visit in a month or 3 months. You've got navigators that are speaking to you on an ongoing basis, coaches and all sorts of things that are there for you. The idea being that we know that when we take care of people with chronic illness in that way, the outcomes are drastically better than when we leave people to their own devices. So it's much more of a navigated concierge-like service for chronic illness. So that would be one of the directions that I really want to take us into. So I want to do something that now we fix the access problem. Now let's fix the quality problem. Let's actually make people's healthcare outcomes better. So that's step number one in terms of our future. The other thing that's paired with is as we actually grow out our network further, more specialties, more proactive programs of care, all of this becomes IP that becomes exportable around the globe. So what I really want to do is take Maple, which is a great success story for doing this whole platform where everything is at your fingertips in all these different areas. And I want to start copying and pasting that around the world. I want to sell that to healthcare systems in the Middle East. I want to sell that to healthcare systems in the EU, et cetera, et cetera. I want to make this made in Canada healthcare IP that other systems can use to actually improve all of their own healthcare provision and access and outcomes.
It's an amazing vision. And I think if anybody's going to get there, I mean, you've got the track record and you've got the great basis. So I'll say good luck on that, but I'll also say I won't be surprised when I see it happen. And on that, maybe one final question. You're playing in a pretty sensitive space, health, lives, livelihoods, data. a lot of stuff that's personal. I often say, the arguments of digital marketing are, well, oh my God, somebody knows I bought a particular product on a website and they remarket me against that. I'm more concerned if someone knows that I got a diagnosis for a fairly substantial disease and it prevents me from getting a job because of a bias. So that notion of all of those elements, you're talking about governments and healthcare systems and personal data. What do you worry about? What's out there that might be a risk?
There's a huge list of risks, unfortunately, to every business, and particularly in ours, given the space that we play in. For us, we have taken a very, very conservative approach around privacy and data. So you will see other businesses that are offering services with the goal to get a lot of your data, anonymize your data, use your data for study, and use your data for monetization purposes. That's not what we're doing. So our philosophy on this is very clear and very unequivocal. And our philosophy is you as a patient have ultimate control and privacy of your data. So nobody sees your data but you and the healthcare providers that are treating you. And even when you are seeing a healthcare provider, you have the right to choose which healthcare data they see. So you can decide that there is a past visit that you think is very private and you don't want any future providers to see. Under Canadian privacy law, you actually have the right to hide that from any future healthcare provider that you see. So that is our philosophy. No administrator at Maple has access to your data. I, as the CEO of the company, have zero way to go into any of our databases and see anything that any patient has done. And there is no way for us to ever provide that to a third party like an insurer. There's no way for us to sell that data. There's no way for us to profit off that data. And that's something that I'm never going to change, because when I think about when we went into this business and why we went into this business, we actually went into this to improve access to healthcare and to make people's healthcare outcomes better. We didn't go into this to take advantage of people, to get their data and for us to profit off of this. And we have to always keep track of that northern light that we're following, because it is very, very easy to follow the temptation of abusing some of these privileges that we've been given and the privilege of taking care of people and having access to their data. And that is a very slippery slope that I think the minute we lose the trust of our customers by taking advantage of that, I think our entire business goes into jeopardy. And I think we've broken the promise of why we started this business in the first place.
Yeah, it's a really good answer, and I think, one that allays trust and comfort in all potential customers, whether it's the consumer, the patient, the healthcare provider, practitioner, and even one of those governments who one day hopefully will start to license the platform from you. So, doctor turned consultant turned tech entrepreneur, always using all of the experiences. Dr. Brett Belchetz, CEO and co-founder of Maple at getmaple.ca. Again, thank you for being with me. It's an incredible story. I look forward to the evolution, and I look forward to my first patient experience on the platform as well. So thank you for being with me today.
Thank you so much for having me. It's been a pleasure.
Take care. You've been listening to Fine Tune. If you haven't done so already, please subscribe to the show wherever you get your podcasts. You can connect with me on Twitter at CFine, through LinkedIn at CorbyFine, or visit my website, corbyfine.com. Fine Tune is produced by me, Corby Fine. Thanks for listening.